Michael, I'm an SVN student. I'm going to be performing NG2 insertion, irrigation, sectioning, and removal. First, I'm going to gather all my equipment. I'm going to take my NG2, which is 14 to 16 French, a cup of water so they can sit in, a basin so I get my 30 milliliters of water for irrigation, a 60 cc syringe, my gloves, and a towel for the patient. First, I'm going to come in and introduce myself, check the patient identifier, place the patient up in a comfortable position for me, also in the high fowlers. And I'm going to explain the procedure, place a towel over their chest, and then I'm going to wash my hands, perform hand hygiene, and then don my gloves. Now I'm ready to begin the procedure. First I'm going to do is I'm going to check the patient's nares and oral cavity, make sure they don't have a deviated septum or any trauma in there, which will now allow me to perform the procedure. I'm going to start off by measuring from the tip of the nose to the lobe of the ear, and then down to the liquid process. Once I get that measurement, I'm going to take it off to show a marker where I need to stop inserting. And I'm going to have a cup of water ready because I want to plan the procedure. I'm going to have the patient swallow sips of water for easier insertion. So once I'm ready, I'm going to have the patient lean their head back, and then I'm going to have them swallow once, about 3 or 4 inches in, I'm going to have them start swallowing sips of water. So I'm going to lubricate it first, obviously. Once I lubricate it, then I'm going to start the insertion. So once I start inserting, about 3 to 4 inches, I'm going to get the patient sips of water. I would have somebody else hold it for me. For each sip of water, I'm going to insert about 1 inch for each swallow. Once I do that, and this generally won't go all the way. Once I get up to the marker, then I would stop. After I stop, I'm going to check for placement, make sure I got it in the right area. If at any point during the insertion, the patient starts to gag or to have difficulty swallowing, I'm going to have them take a deep breath, take more sips of water, and I'm going to check, once I put it in, check if there's any recoiling in the back that would obstruct it from going all the way down to the stomach. So now I'm ready to check for placement. The way I'm going to check for placement is by getting 10 cc's of air, and then listening for a gurgling sound, make sure it's in the right spot. So I'm going to use my stethoscope and place it over the stomach. Once I do that, then I'm going to aspirate 10 cc's of bile from the stomach. Once I do that, I'm going to remove this and clamp it off. Then I'm going to place a bile into a pH strip. The normal value for bile is 0 to 4. So once I do that, I'm ready to begin my irrigation. So I'm going to have about 30 to 40 milliliters of water. So I'm going to use a different syringe for that when I irrigate. So during my irrigation, I'm going to draw 30 milliliters of water, go back into the same port, and I'm going to insert the 30 mLs of water. Once I do that, I'm going to aspirate 30 more, the same amount I put in. So I aspirate 30. And I dispose of this into the basin, a different basin, it's not going to matter where. So once I do that, after I finish my irrigation, I'm going to attach the two sectioning. So once I attach it to the section, I'm going to attach it at a rate of 8,200 milliliters of mercury. It's going to be either intermittent or continuous. Once I do that, once I attach it to the section, I'm going to put 10 cc's of air into the lumen. That way the suction won't attach to the side of the stomach, which will prevent it from sectioning whenever it needs to section. Once I finish that, then I'm going to check the doctor's order again. Now the doctor has ordered for us to DC the NG2. So I'm going to explain the procedures to the patient once again. I'm going to reassure him that it's not going to be as painful as it was inserting. So once I do that, I'm going to have another towel placed over their chest. Before I start removing it, I'm going to have the patient hold their breath. As they hold their breath, I'm going to pull out and hand along with all the other syringe and all that. Once I finish that, I'm going to give a patient tissue, clean up their mouth, do mouth care. After that, I'm going to place the patient in a comfortable position, give them their call light, check for any abnormalities, make sure everything went okay. Then I'm going to document. Any abnormal findings. Also, the size of the size of the NG tube, bottom color, procedure, time, and date. And that's the end of my